and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you for joining us for Department Profiles, a program that looks at various departments throughout the city and goes in depth. Today, I'm joined by the Health Commissioner here in the city of Quincy, Marley Cassley, and he has joined me. This is actually a return to this particular program. So, Marley, Commissioner, welcome. Thanks for coming back.
Thank you for having me. It's a pleasure.
It's a pleasure to have you once again. I want to say a couple months back, we probably had you. Actually, it was before the beginning of this year. We're already in February, so it was actually last year that you were in the studio. And one of the things we're going to talk about today, we talked about then because it's still going on, and that's the pandemic.
Yes, it's still an issue. We have gone through the wave. We have peaked. We did peak a few weeks ago. We had about 500 cases in one day, and now we are averaging 70 cases per day. And on a 1 week and 2 week average, it's 80 cases per day. And we've made a lot of headways with our boosters and our fully vaccinated individuals and reaching out to the public in many ways so that they can get the shot.
And we should mention that the variant, the Omicron variant, is now the predominant strain.
Correct. The Omicron variant is the dominant strain in Massachusetts. Luckily, we applied through a grant through the state for additional funding to create 2 new positions to help our department with the wave of the Omicron variant, and we were approved, and those 2 positions were filled from our last time that we had our meeting together.
And just talk, I can imagine that this is a strain on, well, we know because we hear it on the news, that this is a strain on health departments, not only throughout this country, but throughout the world.
Yes, it is a problem throughout the world at the local level because we don't have that many resources. Luckily, here in Quincy, we have a big department, and when we had to deal with COVID, it was all hands on deck, from the nurses to the housing inspectors to the food inspectors and even our front desk staff. We all came together to do the best we can to either give out the test kits, hand out masks, and make phone calls to the people to let them know that they've tested positive and to follow the quarantine guidelines.
So, Commissioner, the vaccination status at this point?
Yes, Quincy's doing very well. Fully vaccinated makes up 78% of the city. Our booster rate is at 43%. Due to the storm, the rates have not increased, but we are hoping with better weather ahead that we're able to get more shots in ages 5+ are the adults and the seniors to make sure that they're all protected.
Yeah, if you could just talk about that because children have been in the news more recently because the shots have been available for them.
Yes, and children, right now, the FDA has only approved for ages 5+ through parent consent. That may change in the future. They're anticipating that in the next couple of months that it will be available to ages 5 months and older with parent consent. And there's been many locations here in Quincy that we're very fortunate to have to offer vaccinations to the public. We have Mannett, Stop and Shop, Walmart, the CVS's, the Walgreens, and we've even had pop-up clinics either at the farmers market during that when they had their season, and even at our location at the Quincy Health Department to make sure that it's accessible to as many people as possible.
I do need to give a shout out to Mannett because that's where I got both my vaccines and my booster. And what organized process. It was fantastic.
Yes, Mannett does a great job, and we're very lucky to partner with them. We're lucky to have their headquarters here in the city and to be able to have them operate out of 180 Old Colony throughout this whole entire pandemic for testing and vaccines.
I should mention that your department did deliver KN95 masks to us here at the station, and I was wearing one just before we sat down today, so thank you very much. Then talk about the masks and mask availability as well as test kits.
Yes, we did provide 18,900 test kits to the public to the best of our ability. The state provided them for free to a population of 101,600. So it was very difficult, but we did it to the best of our ability through partners and even walk-in clinics to pick up the test kits before Christmas. The masks were from FEMA, And through Ali Sleeman's Department of Emergency Management, we were able to provide the city with 75,000 KN95 masks. And we're hoping to get more masks in the future. We are awaiting our shipment for at-home COVID-19 test kits that were purchased early January. Those should be coming in, and we will supply the public with KN95 masks and test kits on the same day once they become available.
And you mentioned coordination with other city departments, specifically emergency management. Very important that everyone works together. It's certainly for the benefit of folks.
Yes, and the whole city has, worked together through other departments to make sure that we can get as many people vaccinated, test kits available, and masks. And people are able to pick up cloth masks at our office as well.
We had mentioned the positivity rate is decreasing currently.
Yes, we did hit a peak positivity rate of 25% earlier in January, and we are at now 11%, and that is continuing to drop. And we're hoping that it drops, below 5% in the near future.
And the booster shot rate is increasing, I believe.
Yes, it is increasing. It's at 43%, and we are offering more clinics at our office through Manit, the Kraft Foundation, and even Brewster Ambulance to make sure that there's a lot of access to get the shot.
You talked about city departments and working with city departments, but you mentioned two organizations outside of the city, and that is the Kraft Foundation and Brewster Ambulance. Of course, Brewster services the city.
Yeah. Yes, and we do have a clinic with Brewster coming up this Saturday, February 12th, from 10 a.m. to 1 p.m., and that is a Pfizer-only clinic. We are also working with the Kraft Foundation on Saturday, February 19th, from 10 a.m. to 2 p.m., and Saturday, March 12th, 10 a.m. to 2 p.m. at the Kennedy Center, and this is a Pfizer-only and testing as well. And Manit, we are working with them on Friday, March 4th from 9:30 a.m. to 12:30 p.m. and Friday, April 1st, 9:30 a.m. to 12:30 p.m.
And I know, of course, people watching this program got those dates and those clinics right here, right now. But if anyone is wondering after this program has aired or in between airings of this program, where else can they go to get this information?
They can go on our website. They can go to our Facebook page that has recently been created as of last year, and also, accessing Manit's website as well.
The flu has been overshadowed by the pandemic. What can you tell me about the flu here in the city of Quincy this year?
So we don't have any numbers on the flu for Quincy this year, but what we are hoping to do in the future, now that we have purchased 2 brand new vaccine fridges, we're hoping to offer flu clinics to the public in the future, and also offer it to the homebound so that we can go to their location and provide them with the flu shot from our nurses.
And this is a simple thing that everybody can do that would potentially keep them from getting the flu, keep them from getting the COVID-19 and its various variants. That is something so simple as hand washing.
Correct. Hand washing is key.
And I know that I won't have you sing, and I'm certainly not going to sing today, but people should really realize, well, first of all, they should use warm, soapy water, and they should not be too quick. They should sing 2 courses in their head, or maybe out loud, it depends on if they're a performer or not, of Happy Birthday. And singing 2 choruses of Happy Birthday is a really decent time to get those hands clean.
Yes, and I either use the Happy Birthday song or the alphabet
okay.
to clean the hands.
So go through the alphabet once or Happy Birthday twice?
Yeah, either or, but you want to take your time and make sure that you're cleaning your hands properly.
I'm after my 17-year-old because it sounds like he turns on the water and 2 seconds later he turns off the water. So I'm always mentioning, scrub your hands, move the soap and water around and make sure you get the backs of your hands and the fronts of your hands. It's not that much time that you really need to spend to do it right, and it does make a difference.
It does make a difference, and it's very concerning to me when people are in public in restaurants and they're not properly cleaning their hands in the bathrooms.
And we should mention that not doing that and touching your eyes or touching your mouth or touching your nose, those are all entryways for germs.
Correct.
Let's talk about some blood drives and some upcoming, I assume, blood drives that the health department is involved in.
Yeah, so this is the second year in a row that we're working with Dana-Farber on a blood drive at our location. We've never done it before, and we started off with just one blood drive at our location, and there was very high demand for it. So this year we've added 3 blood drives at our location, and they will be on Friday, March 18th from 9:30 a.m. to 4 p.m., Saturday, June 18th, 9 a.m. to 3 p.m., and September 23rd, 9:30 a.m. to 4 p.m.
Now, what do people need to do? Do they need to register, or do they simply come down during those dates?
So they can either come down on those dates, or they can sign up on our website. It will be able to link them through the Dana-Farber so that they can create an account and pick a time slot.
Very good. And quincyma.gov is the City of Quincy website. There is a list of departments. The health department would then be a tab on that site, and you would get to the commissioner's page, and all of the relevant current information would be there for you, including information on these blood drives. Let's talk about something called the mammogram van, and this is happening in May.
Yeah, and this has never been done before, and again, this is another service that is through Dana-Farber. That really caught my interest because mammogram screenings are the #1 screenings to detect breast cancer in women. And I think it's very important that we can provide this to the public here in Quincy so that people don't have to drive 20, 30 minutes away for something like this. So we'd like to bring it to them here at the Kennedy Center, and those dates are on May 7th, 9 a.m. to 3 p.m. and May 14th from 9 a.m. to 3 p.m.
And again, for registration, does that need to be done ahead of time?
Yes, so they will need to register either through our website or through the Dana-Farber website as well.
And the address for the Quincy Council on Aging, the Kennedy Center?
So the address for the Kennedy Center where all these events are held is at 440 East Squantum Street.
Which is also the headquarters of the Quincy Health Department.
Yes.
How convenient, right?
We're in a great location, and we're very lucky to work in hand with the other services.
As we talked about blood drives and the mammogram screenings, obviously the pandemic has affected those because people haven't been going for screenings. Mm-hmm. They haven't been giving blood because of concerns with COVID just simply getting out. And that's a problem.
Yes, it's a major problem, especially if you're not able to get your mammogram screening in time or donate blood, and even the skin cancer screenings that we'll be providing this year as well. So last year we worked with Dana-Farber as a pilot program, and we offered 2 skin cancer screening events to the public, and all the slots were full. So we're hoping to bring that back again this year so that people can have access to these types of screenings, and they're all free and they're very important.
I know that when I was younger, I wasn't so concerned about the sun, but now as I'm getting older, I am concerned about the sun because it's great, and I love a day at the beach, but it can cause damage.
Yes, and I love the beach myself, but it does cause damage, and it's time to be concerned about it.
A nutrition class with the Council on Aging, again, a great partnership. What better than to teach seniors the best way to stay healthy by eating the right foods?
Yes, working with Tom Clasby has been amazing. We've been offering the nutrition class since July of last year, and we offer it each week on Tuesdays, and the whole class is full, and they enjoy it, and they love it.
I would say, how do people find out? But clearly that's not a problem because the class has been full. I assume that the Council on Aging, the Kennedy Center newsletter, it's listed in there, but once again, they can either call the health department, which actually we should probably give out the health department's number if folks want to call as opposed to go onto the website, because you do pick up the phone there and you will chat with folks that way too.
Yes, anyone can call us at any time to express their concerns or find out additional information. Our phone number is 617-376-1414. 1275.
Commissioner, I want to thank you for joining me here today, and of course welcome you back for another episode of Department Profiles, and possibly to actually participate in some of these clinics, some of these drives. Would be interested in maybe checking out the mammogram van for the mammogram screenings, and maybe pop in on a nutrition class just to see exactly what all of this is about. But it sounds like there's a lot going on in the city of Quincy, and there's a lot going on with the Quincy Health Department and its association with not only other city departments, but other foundations beyond the city limits.
Of course, and we're looking to do a lot of different things. Our inspectors now are doing inspections on their iPads, and people have the option to pay online. So we're looking to reinvent the wheel and make sure that people have more access to our programs and easier to find what we are doing at the health department. And the biggest key is, to make sure that these programs and what we are doing, can make a difference.
Well, certainly utilizing Quincy Access Television, we're certainly here for you to use as a means to get your information out there as well. Anytime, simply give me a call and we'll sit down and chat just like we did today.
Awesome. Thank
Great.
you very much.
Thank you.
Truly appreciate it, and I hope to be back soon.
Well, the invitation is open, so we'll see you soon. Thank you at home for watching. You have been watching a program of Quincy Access Television. Please continue to watch QATV for more locally produced programming.